Is a wound in which tissue undergoes coagulative necrosis as a result of thermal, chemical, radiation, or cold injury. Simply put, exposure to these harmful agents causes tissue proteins to denature, leading to irreversible cell death. The severity of a burn depends mainly on three important factors. First, the temperature of the injuring agent. Second, the duration of exposure. And third, the type of agent responsible for the injury. The higher the temperature and the longer the exposure, the deeper and more severe the burn becomes. Burns are classified according to the agent responsible for the injury. Ordinary burns are caused by dry heat. Scalds occur due to hot liquids or steam. Chemical burns result from strong acids or alkalis. Electrical burns occur due to electric current. Radiation burns develop after exposure to ionizing radiation. Finally, cold burns occur after prolonged exposure to extremely low temperatures. Although the causes differ, all of these injuries ultimately produce the same result: coagulative necrosis of tissue. Electrical burns are unique because the skin injury often appears surprisingly small. Structures such as muscles, nerves, and blood vessels offer relatively low electrical resistance. As a result, they sustain the greatest damage. Moist skin has much lower resistance than dry skin. This explains why areas like the axilla and the antecubital fossa are particularly vulnerable. Another important is the appearance of port wine-colored urine. This occurs because extensive muscle destruction. Radiation burns occur following exposure to ionizing radiation, such as X-rays or radioactive materials. They are broadly divided into two types. In acute radiodermatitis, patients usually present with redness, swelling, pain, and skin irritation. The second is chronic radiodermatitis. Its most important clinical significance is the increased risk of developing skin cancer. Cold burns result from prolonged exposure to extremely low temperature. The most severe form is frostbite, in which body tissues actually freeze. Ice crystals form inside the cells, causing direct cellular injury, dehydration, and blockage of the small blood vessels, causing coagulative necrosis. Other important cold injuries include chilblains, which produce painful red swelling of the fingers, toes, or ears after exposure to cold and damp conditions. Trench foot develops after prolonged exposure to cold, wet environments and was classically seen in soldiers. Frostbite is classified into 4 degrees. First degree frostbite causes redness and swelling. Second degree frostbite produces blister formation along with partial thickness skin injury. Third degree frostbite destroys the full thickness of the skin. Fourth degree frostbite is the most severe form. In this stage, the skin muscles undergo necrosis, eventually leading to gangrene. Thank you for watching. See you in the next lecture.